There are likely to be additional questions on the material covered. Here are a few of the more common ones. What rate does the VA pay when a veteran is referred to a community provider for care? Generally, VA will pay Medicare rates, although there are several exceptions to this rate that may apply as needed, which will be established through a contract or agreement. How will those veterans who are eligible for mileage reimbursement for beneficiary travel expenses be impacted under the VA Mission Act? For those veterans who are eligible for reimbursement for beneficiary travel expenses, their eligibility will not change under the VA Mission Act. Beneficiary travel will be paid the same way whether the care is provided at a VA medical facility or through a community provider. Do the changes to community care under the VA Mission Act mean that VA is being privatized, or that funds meant for VA medical facilities will be rerouted to the private sector? Improvements to community care under the VA Mission Act are part of a larger effort to modernize the VA healthcare system and give veterans more options in how they get their healthcare. This in no way represents efforts to privatize VA or shift resources away from VA medical facilities. AMVETS believes the VA and community care both require adequate funding that diminishes neither. And the first choice of every veteran is timely access to the best care available in the VA healthcare system. What effect does the VA Mission Act have on access to emergency services and other lesser-known VA community care programs besides the Veterans Choice Program? Over time, Congress has authorized additional programs to provide care through non-VA community providers or entities, each with their own unique requirements. In addition to the Veterans Choice Program, the VA Mission Act amends the legal framework around several existing veterans care programs. Regarding emergency services, specifically, prior authorization by VA is not required when a veteran receives emergency care and the VA is notified within 72 hours by the veteran or a representative, provided certain additional conditions are met. One being, the emergency care must be related to a service-connected condition. Similarly, the Mission Act does not change statutory provisions for emergency care for non-service-connected conditions for enrolled veterans who received care within a VA facility during the 24 months before the emergency care was needed, and the veteran is financially liable to the provider of the emergency treatment. In either case, claims must be submitted to the VA within 2 years of the date the emergency medical care was received. Where can I get assistance or answers to any additional questions I may have? AMVETS HEAL Program assistance is available by calling 1-833-838-4325, Monday through Friday from 8 a.m. to 5 p.m. Eastern Standard Time. You can also receive assistance via email at vetheal@amvets.org. Our team of clinical advocates is standing by to assist you. Veterans, families, and caregivers can read more about the Mission Act by logging on to the VA Mission Act website. For general Mission Act-related health inquiries, call 1-844-698-2311. Should a veteran experience an issue related to medical care in the community, he or she can report it through the Tri-West customer service line at 1-855-722-2838. AMVETS will be holding several live online Q&A sessions as a follow-up to this presentation in order to address any questions. More information on those sessions, including dates and times, will be available online. Find us on Facebook and Twitter at AMVETSHQ, or go onto our national website at amvets.org. While trying to grasp all of these new rules and standards can be overwhelming, the best approach is to explore how they impact your individual case before you need urgent or emergency care services. It's also important to remember, determining your best path to wellness begins with a conversation between you and your healthcare provider as you decide how to access care.